Attention Deficit Hyperactivity Disorder, ADHD. This might sound uncommon to you, but do you know this thing that many of us are suffering from it? Hello and welcome to the InFocus series of Drishti IAS. I am Ritu and today's session is about ADHD and we are going to discuss this symptoms, signs, medications, and this session is important for your GES 3 perspective. Moving towards the points of discussion part. So first of all, we are going to discuss the news, then we are going to discuss about the disorder, then we are going to discuss about the types, then signs and symptoms, then what are the possible treatments we have, and then practice question for prelims. Before that, you have to like, share and subscribe to this TIAS channel. So before moving to the news, I have an important announcement by Drishti IAS. So as you already know that Drishti IAS has several branches across the country. So we have ISGS Foundation course, which is prelim cum mains. So in Lucknow, 16th October, the classes will start by 8 am. Karol Bagh, 17th October, 8 am. Indore, 13th November, 3:30 pm. And if you want to know more information, you can call on to the number 8010440440, 8010440440. And if you are staying nearby, you can also visit to the offline center. So coming to the news part. So a Bollywood actress had recently shared this thing in an interview that she has been diagnosed with the ADHD. And she said that while she was in school, she often feels that she was zoned out. During her shoot also, she often feels that she was zoned out. She could not pay attention to a particular thing. And she did not get that what happened to her. After a psychological test, she has been diagnosed with the ADHD. So we are going to discuss about the ADHD because this has become a very common thing and many of us are unaware about this, that why we are suffering from this. This can be also a mental disorder. So coming to the next one, which is about the ADHD. So attention deficit hyperactivity disorder is a neurodevelopment disorder and marked by the hyperactivity and impulsivity. So here two keywords are there, hyperactivity and impulsivity. And people who have ADHD are unable to focus on a particular thing. These are the few symptoms we have, and experience a greater level of inattention, change in energy levels according to their peer. So this is about the ADHD, that this is a neurodevelopmental disorder and in which we have a problem of hyperactivity, impulsivity, and sometimes we are unable to pay. Sometimes our energy could not match to the peer level. Sometimes it can be low and sometimes it can be so high. So this is about the ADHD. Now we'll come to the types. So here they had decided the 3 types of ADHD. So this has been taken from the CDC. So predominantly inattentive presentation, hyperactivity, impulsive presentation, and sometimes combined also, which has a combination of inattentiveness and hyperactive impulsive symptoms. So these are the 3 types we have. Few people have inattentive problem, few people have hyperactive impulsive problem, and few people have combined problem. So they can have sometimes inattentiveness, sometimes they can be hyperactive. So these are the types we have, and generally it is found in children. But what happened that after 1990s we had discovered and we had found out that this problem persists in adult also, and sometimes children diagnosed with the ADHD, their problem can retain to the adulthood also. So this is not just common to the children. Right now it has been found among the adults also, but it is very common among the children. So here we have signs and symptoms. So we already had discussed about the signs and symptoms regarding the hyperactivity, inattentiveness, impulsiveness, and sometimes they are unable to follow the instructions given in the class or instructions given by someone's, and focusing on details and disorganized. So sometimes these kind of the people live in a very disorganized manner. Sometimes they are unable to follow your instruction, that what you are saying. Sometimes they are zoned out. So this is the thing, and they are easily distracted, and you can say that sometimes they forgot few things. So this is considered as a very common problem in our country, but might be they are suffering from ADHD and forgetful about the task, lost personal items, and short attention span. So these are the common thing, and I think many of us are having such kind of problem, but we are unable to diagnose it and we are unable to identify it. Now we'll come to the next one, which is about the treatment. So do we have treatment available for it? So if we'll come to the psychological test, so we do not have a prescribed any psychological test for the ADHD, but we do have a psychological test, and after having multiple tests we are able to know that we are suffering from ADHD. So if we'll talk about the treatment, because this is generally found in children, so here the training activity is happening with parents also, because parents have to pay attention, the teachers have to pay attention, the children who are suffering from such kind of a disorder. So the training among the children and parent and teacher is compulsory. So the training is compulsory and everybody should be connected about the child, and there can be behavior therapy, and in which the parents and children are trained in a certain way, and also if it becomes severe, the medication is also available. So here the treatment is first is that behavioral therapy. So with therapy many of us can be cured, and if you're not getting cured, there is a medication facility also, and having a healthy lifestyle can cure your problem. So sometimes we have this kind of myths that if you are watching so much of TV, if you are watching or checking so much of mobile, that can create ADHD problem. So we do not know that what is the exact cause of ADHD problem. Some scientists have suggested that might be genetics, might be poor healthy lifestyle, but the watching extra screen and also having a very bad lifestyle can worsen your problem, but that cannot be a origin of the problem, and that cannot be a root cause of such kind of the problem. So this is a myth. So if you are maintaining a healthy lifestyle, there are high chances, if you are having a good food, healthy food, if you are doing proper exercise, there are chances to have reduction in such kind of disorders, but we cannot say that they are the root cause of the problem. So this is about that. Now we'll come to the question, how it is the common. So worldwide, according to the World Federation, around 6% of the children are suffering from it, and in adults around 2.5% adults are suffering from it. So you can see that children number are more, so it is mostly common in children, and adults are also suffering from it, but their number is less. So this is about that, what is the data related to ADHD we have. Now we'll come to the question round. The question is, ADHD is classified under which of the following categories? Neurodevelopmental disorders, cognitive disorders, behavioral disorders, and psychiatric disorder. This is very easy one. I think you are able to answer into the comment section. I hope you like this session. If you have queries related to this session, kindly ask in the comment section, and do prepare this topic for your mains also, but generally it can be asked in your prelims examination. But if you are writing something related to the essay or ethics paper, and if you are diagnosed and if you know about such kind of disease, this might help in your mains also, and sometimes in your interview examination. So if you have to prepare any topic, you have to prepare for every stages of examination, prelims, mains, and interview also. Thank you. Have a nice day.
For more informative content, like, share and subscribe, and do not forget to press the bell icon to get the notifications.